One common condition I treat in my office is TMJ pain. So TMJ is the joint that's right here. When we open and close, we can feel that joint moving. Now sometimes what will happen is that joint will become very painful and it'll become difficult to open your mouth, or it'll cause your jaw to deviate to one side or the other as you're opening. One of the most common causes of TMJ pain is tightness in the masseter muscle. So the masseter muscle runs from the upper cheekbone down to the lower jaw. It's a very powerful muscle. It's used in clenching, biting, stuff like that. So in TMJ cases, it's often very tight and can cause a lot of pressure on the joint. So in my office, how we approach treating TMJ pain is we often will treat the masseter muscle using dry needling. So how dry needling works is we place a little small acupuncture needle into the tight tissue, and what it does is it causes the muscle to relax. It helps to break up any of those knots or adhesions inside that muscle that are causing it to put a lot of pressure on the joint. There's often what we call trigger points or knots in the muscle that can cause a lot of pressure and tension on the joint itself. And all dry needling does is it helps to break up that trigger point or that muscle knot, which allows the muscle to stretch and move like it's supposed to, and that reduces the stress on the joint itself. So dry needling is different than acupuncture. It's a technique where we use the same needle, but the whole purpose is to help break up those knots or the trigger points inside the muscle. And basically what happens is when you put it into the knot, it causes a signal up to your brain, and the output to the tissue is to relax that muscle. A lot of times you'll feel like a deep, dull achiness in that area. And once we're done with the procedure, patients can feel an immediate relief and pressure on the joint. It's very effective. We do it both in chronic and acute cases, and I highly recommend it if you're suffering from TMJ pain. Some reasons why that muscle will tense up is, one, if you're under a lot of stress, we carry a lot of tension in our jaw, in our head. If you grind at night, that'll cause these muscles here and the masseter muscles to get really tight, and that puts a lot of pressure on the joint too. And again, the dry needling is a very effective way to kind of reset that muscle and allow it to relax and allow that jaw to move in a proper motion and reduce that tension on the joint. So if you're suffering from TMJ pain, give my office a call at 703-912-7822 or schedule online at novacarewellness.com.